Hello, everyone. Thank you so much for helping on. My name is Ryan Simonyema. I'm a fourth year radiography student and also a medical writer. So today I have an amazing guest speaker all the way from the UK, Dr. Giovanni. Hey, could you introduce yourself to the audience?
Hi, everyone. My name is Dr. Giovannie. I am a neuro-disability physiotherapist specialist. And yeah, I'm happy to be here.
Amazing. So, Dr. Giovanni, we have a couple of questions for you to answer. You ready?
Yes.
All right. If I'm looking downwards, I'm reading the questions to Dr. Giovanni. So he has been wondering what am I looking downwards for? Because I wrote down the question on a piece of paper. All right. Inspired you to start PROBr, right? And what unique value does it bring to the physiotherapy sector? Because I know you're a physiotherapist. So talk us
Mm,
through.
yes. The inspiration came from work. One day, basically being approached by one of the staff members asking if somehow we can get some of our patients or students involved in some clinical trials. And with me working with a lot of these students, I thought that would be a great opportunity for them. And so I went online looking for resources, things that would cater to their demographic. And to my surprise, I couldn't find anything or anything that was close to what we thought would be helpful. So that's where the birth of PROBr came along. And basically, this platform it helps physiotherapists and other health sectors with research, inspiration, and execution. So it does help physiotherapists, but it also helps a broader range of health sectors as well.
Amazing. It's amazing to hear that it's not only the physiotherapy, sector it's focused on, and also different healthcare sectors as well. So thank you so much for talking us through about that, behind the scenes why you founded that amazing, platform. So, so before we move further, tell us why did you choose to study physiotherapy in the first place?
Yeah, I think it came from when I first played sports in high school, and I loved playing sports, but then I also loved the recovery process. And that had more to do with athletic training. But then when people were injured and also people coming out of surgery, I never thankfully had to go through surgery. But witnessing my teammates going through surgery and talking about how physical therapy helped them go from a baseline of 0 to 100 was incredible. And I always thought of myself as helpful as well. And playing sports at a collegiate level, so in university, so at a high level, I also got to experience seeing physical therapists helping other athletes and seeing that there's a bigger market out there. So they don't just help with patients, I mean, with athletes, but they also help with patients from different conditions. And that really intrigued me a lot because there's a big space where you can go into it.
Amazing. You know, in a nutshell, sport medicine practitioners sounds their work kind of like sounds familiar with physiotherapists. What do you
Mhm.
think?
It sounds pretty similar, yes. There are a lot of crossovers, I would say. But there are some fine distinctions that do differentiate our professions. For us, we kind of play a role into the rehabilitation process. We can also help with recovery as well. But I would say with our main suit, it's kind of being the specialist and helping people move again and being able to reach to their greatest potential.
Amazing. So thank you so much for talking us through about what really made you to, choose that amazing profession, to being a physiotherapist. So the next question is, how do you balance your role as a clinical entrepreneur and a specialist physiotherapist within the NHS? Talk us through.
Yep. So I would say at the moment, I am working part time clinically, and sometimes I may work full time. It really depends. But I would say at the moment, because I am running a startup, part time is the best way just so I can give full time efforts to my startup. And so it's really ensuring tasks are spread across my team. So I'm thankful that I do have a team that trust me and also trust the company as well. And so I do delegate tasks, and also like we all discuss what tasks work best for all of us in our schedule when needed. And there's no perfect formula for this, for being a clinical entrepreneur and also a clinical specialist. And so I would say it just requires a lot of sacrifice, and it requires knowing your limits. I have a high threshold for limits, so I can kind of run on little to no sleep, which I know a lot of people can't. So I'm not endorsing that by any means. I'm just saying that that's kind of it works for me. I can kind of sustain that for a long period of time.
Hmm. Wait, hold on a minute. You know, before we proceed further, what do you mean by someone being a clinical entrepreneur like you? What do you mean?
The clinical entrepreneur, I'm kind of referencing the NHS Clinical Entrepreneur program
Oh,
that I'm in. So
amazing,
yeah, so being in
amazing.
that program, it's yeah.
I know you also work as a physiotherapist in the NHS as well.
Yeah, so NHS or like private as well. So it really just depends. I do contracted.
Hmm, hmm, hmm. All right. So thank you so much for talking us through about how your role as a clinical entrepreneur and a specialist physiotherapist within the NHS. All right. So the next question for you is, can you share any success stories or notable outcomes from patients who have benefited from PROBr's services? Talk us through.
Of course. So at the moment, PROBr is in the early stages. So we do not have any active patients using the platform. Um, so obviously, yeah, do stay tuned for opportunities for any patients who are one or who are curious about PROBr's platform. However, we
Yeah.
have been finalists in for sorry, we have been finalists for some awards and have won a couple as well. So that has given us some sort of validation, but then also that kind of plays a role into the creation of our success story. So it's nice to get validated in that sense because it shows that we are doing something right. And then there are a group of people who do recognize what we're doing and they endorse that as well to some degree. So that would say
Mm.
that would be our kind of success story at the moment.
All right. So that was an amazing introduction based on your platform's services, and I believe that people are tuned already. To use the services of that amazing platform. Below. So if you're really interested in PROBr's services, the links will be added in the YouTube description below. Can connect with Dr. Giovanni for the next steps. All right.
Yeah,
So
so our website is www.probr.co. And
yeah, it's gonna be added on the YouTube description below as well, in case y'all forgot about it. So the next question is, okay. This question is a little intriguing, but I know you're ready because you said you're ready for it. So the next question for you is, what are the biggest challenges you've faced in your journey as an NHS clinical entrepreneur, and how have you overcome them? Talk us through.
yeah, I would say the biggest challenge for me personally would be coordinating my schedule with the scheduled opportunities that the NHS entrepreneur program provides. So with being in the NHS CEP, you have so many opportunities, so many resources. Like it's so many, and you want to jump at every single one of them because it's integral and it's helpful to your startup. However, a lot of those opportunities and events can conflict with your schedule, and like it can be at any given date and time, which may not work for every clinician. There were some instances where I had to obviously like not show up to some of the events, and I wasn't able to sign up to some of them because of my other schedules. And it is a shame, but obviously that is how it is, especially when you are working as a clinician as well. And a lot of these events, they are great opportunities that you don't want to miss. So I would say that is the biggest challenge because I do feel like I am missing out on some of them that I can't attend.
Mm, mm, mm. Amazing, amazing to hear that you are also striking a balance with your work as an NHS clinical entrepreneur, and how you're, being able to overcome some of those terrible challenges as well. So, do you think, before I move further to the next question, do you think that physiotherapy is is the best decision you made? You wanted to study. Like, are you happy about studying that course?
Yeah, I think this is like a question where I go back and forth with it because initially when I first started my bachelor's, I originally wanted to do pharmacy, but then I changed my mind because I was like, I don't want to endorse medication. And I was like, I wanted to endorse movement instead as a form of medication. But I think for me, I think because the way that physiotherapy policies are and the scope and how we're viewed as, because I think the public views us as massage therapists still. Um, I would say if all that stuff can was fixed, especially to the way that I would like physiotherapists to be perceived, I would say this would be the best profession. But I do think that there are some issues regarding this profession and us having to advocate for ourselves as clinicians in physiotherapy, especially other parts of the world. So it's still a profession where we're still having to advocate and gain respect from it. So yeah, I mean, I do love the profession because I know what it is, but I think it'd be great if everyone else knew what we see.
This question, it's relates to the next question we have for you. All right, because what I said is, like, what really prompted me to ask you the reason why you know chose that profession, which is an amazing profession in medical field, because there are a lot of misconceptions about physiotherapy, and it's amazing that you're advocating for yourself and trying to bridge that gap about what people really think that profession is all about. So thank you so much for talking us through about that. So how do you see physiotherapy evolving, and what role do you think technology will play in? Talk us through.
Yeah. So I see physiotherapy changing with being better defined for patients. So if you ask a patient, um, what is physiotherapy, the first thing out of their mind won't be massage. It'll be rehabilitation and to know how to describe it as well. I know that there are a lot of patients they do get confused with different professions, and I guess it is our place to try to educate the people on what our profession does and just have like a single word that describes it, an adjective, something. Um, I think that there are people who still correlate, yeah, physiotherapy with other things besides rehabilitation, as I said, and and that's not the case, especially in 2024. It's evolved so much, especially with the CSP, which is the hold on, I need to think about that. Hold on. Okay, so let me rephrase that again. So yeah, I do think that especially it's not the case in 2024. So we do have the Society for Physiotherapy, and they have increased our scope of practice, which has allowed us to integrate rehabilitation with other parts of treatments that help to increase the recovery time for their treatment plans, things like that. And I would say technology can be supplementary for physiotherapy, but our profession but with our profession and us being clinicians, we are very skeptical about introducing or using new technology as a main premise of physiotherapy, just because with physiotherapy, the whole point of it is to endorse independence. So using new technology as the main premise of physiotherapy is not. is not like kind of following that alignment, especially when you use technology such as ultrasound, like, and not the ultrasound where you do scans, but ultrasound to like help with pain. A lot of, well, old practices, very vintage physiotherapists, they may use that in their practice as the only way for treatment, and a lot of patients get dependent on it instead of movement. And we kind of want to get rid of all that. And yeah, I would say sorry, yeah, too much, too much
Amazing.
technology. Oh, go ahead.
Okay, sorry for cutting you off. Like there's something I want you to talk more about. You know, that word you mentioned about ultrasound. You know, we all know that because I'm a radiography student. All right, we ultrasound is like one of the fields, specialized fields in radiography. Like you study radiography, you want to specialize in ultrasound. You're going to become an ultrasonography or ultrasonographer. Sorry. So tell us, talk us through about that instrument. You mentioned about vintage physiotherapists in the olden days using to, even they're using it currently to, work as a physiotherapist. Talk us through about more about that instrument.
Yeah, so ultrasound, there's two different, I mean, like, especially with ultrasound, you have to kind of describe it on Google because they can give you either or. But this sort of modality, it it's kind of, it has like a nozzle, and it's like a metal nozzle in a way, and you add like gel to it, and you just apply it onto typically like the knee of the patient, and that helps with pain. It's supposed to help with pain, and it's supposed to help with like increasing, it's, I mean, it's placebo. But a lot of clinicians do say that it is good to use. However, with modalities, I do recommend using it as supplementary, so using it in conjunction with something rather than using it as the whole treatment itself, because that won't do anything for the patient. So yeah, but yeah, ultrasound, it's a old big machine where, yeah, you would basically add gel to it, and then you would apply it, and it releases some currents through the gel to the
Mm.
patient's parts.
That's also related to radiography for people that chose that profession to being an ultrasonographer. They use that kind of methods, to scan through the patient, and that's synonymous to also scanning in physiotherapy, but don't call it scanning. Like relieving of pain, like you said, using the modality. So thank you so much for talking us there about that. So then, last question for you is: so in a nutshell, what advice do you have to give to other healthcare professionals who wants to innovate and start their own business? So tell us.
I would say if you caught the innovation bug, um, to take that as a sign to go for it. There is nothing wrong. There's nothing to lose and everything to gain. Starting a business may not lead to a successful business. However, you will learn so much about yourself and your hidden superpowers that school and your peers could never teach you. Stepping outside of your comfort zone is always a win, and not many people can do that. So that makes you special already if you can take that step.
Amazing, amazing, amazing. Dr. Giovanni, you've been an amazing guest speaker thus far, and I believe that the audience are really, really enlightened based on your own initiative and narrative and those amazing and intriguing questions being asked, to you. So we've come to the end of the session, and you know, if so, before we wrap up the session, what are your last words for the audience?
Sorry, can you say that again?
Your last word for the audience. What are your last words before we wrap up the session?
I would say, and I'm going to say this because I recently read it, and I think it's a good reminder, even if we know it subconsciously. Before you do anything, or before yeah, you take any action, make sure that you confirm whatever you read, and make sure that make sure that you have discernment and that you always do your research and not just take people's word for it, because you'll find that doing your own research, you educate yourself even more, and you can find a greater wealth of knowledge.
That's awesome. Yeah. Thank you so much, Dr. Giovanni. So if you love this content, do well to like, share, and subscribe as well. Comment as well if you have any other questions related to physiotherapy or related to whatever Dr. Giovanni said that you didn't understand. You can connect with her on LinkedIn, and she's willing to help you as well. So thank you so much. Thank you, everyone.
Thank you so much. Thanks. Bye.